So some topics I'll be going over are what is primary progressive aphasia, some communication challenges, as well as some therapeutic approaches, and a little bit about our research. So some terms that are helpful to know when I'm describing what PPA is what aphasia is. So it's a language disorder due to damage to part of your brain that started sometime after birth. So an aphasia can be caused by a stroke, a brain tumor, a neurodegenerative disease, multiple things. And for primary progressive aphasia, it's a language disorder, so an aphasia that gets worse over time, so it's progressive. And the most prominent problem is the aphasia, so that's why it's called primary. A dementia, as Dr. Dickerson mentioned, is an overall term that describes a wide range of symptoms associated with a decline in thinking skills that reduces a person's ability to do everyday activities independently. In order to have a PPA diagnosis, the prominent problem in the initial phases, especially in the first 2 years, is with speech and language. In the later stages, other symptoms such as behavioral symptoms, cognitive symptoms, or motor symptoms may appear, but usually that's not in the first 2 years to have a PPA diagnosis. Individuals with other disorders such as Alzheimer's or behavioral variant FTD may experience communication difficulties as well, but it's not the most prominent feature. Hallmark changes in behavior and personality, however, can cause communication difficulties, but as I said, it's not the primary symptom, but the behavioral changes, such as having apathy, leads to symptoms such as not initiating conversation as much, not expressing emotion, not engaging in conversation as much, and disinhibition may lead to saying inappropriate things, or an inappropriate increase in talking, or difficulty reading social cues when having a conversation. Some other important terms is just to think about the difference between speech and language. So speech is the physical productions of the sounds of a language, so it's a way of getting your language out. However, language is the actual expression and understanding of thoughts, ideas, and concepts through a shared symbol system, so it's important to realize that speech is one way of getting language out, but there are also other ways like sign language and writing, gestures, things like that. So I'll be going over the 3 different subtypes of PPA, the 3 subtypes being Nonfluent, or otherwise known as agrammatic variant, the Semantic variant, as well as the Logopenic variant. So as I go through the different variants, I'd like you just to keep this picture in mind. So some of you who are in the room who have seen this picture multiple times because I asked you to describe it, I just want everyone to keep this in mind because I'm going to provide speech and language samples of people in the various variants describing this picture. So the first subtype, the nonfluent or agrammatic subtype, one symptom is having nonfluent speech. So in their speech, you might have hesitations, pauses, false starts, and a lot of the time, a person with this subtype will have articulation difficulty or apraxia of speech or dysarthria, some terms that are used to describe the articulation difficulty. There may be some word retrieval difficulty, although this variant, the word retrieval difficulty isn't as prominent as in the other variants. They may have something called agrammatism, which is difficulty producing and comprehending complex grammar in sentences, as well as some reading and writing difficulty, especially of those complex sentences. Comprehension is relatively intact. However, again, like I said, complex syntax may be impaired when the communication partner is using those types of complex language. So this is a speech and language. It's a sample of a person with this variant describing that picnic scene I showed you.
Flying a kite, boy flying a kite, and garage,
So as you most likely noticed, there was some pronunciation difficulty as well as using pretty simplified sentences to describe the picture. And Dr. Dickerson described some of the pathology that occurs with these different subtypes, and tau is the one that's often associated with this certain subtype. The next variant that I'll be describing is the semantic variant. So unlike the agrammatic, a non-fluent subtype, their speech is usually perfectly fluent and grammatical. However, because of a lot of difficulty with word retrieval, it has an empty quality to it. So they may say, use vague words such as, that stuff has a lot of things on it over there. So difficulty coming up with the most precise language to describe something. They may also have difficulty with understanding words. So if you ask your loved one, especially if you ask them to ask for something that's not very common, they may have difficulty understanding what you're saying. So if you say, can you get me the strawberries, they might not know exactly what a strawberry is. Especially for animate objects, so living objects, those are sometimes more difficult than inanimate objects. And they also may have something called surface dyslexia, so difficulty recognizing certain words and reading, especially irregular patterned words. That's sometimes difficult for them to understand. So this is a sample of someone describing that picnic scene who has a semantic variant PPA. Oops, sorry.
So they're sitting right there. She's playing something with it for maybe some water or something. He's reading an item.
So as you can see, a lot of vague words, but a fluent quality to it. But if it's an outsider who's not familiar with the person, maybe they have a little difficulty of figuring out what they're talking about. And this variant is often associated with TDP-43 pathology. The last variant that I'll be talking about is the logopenic variant. Oftentimes they have an inconsistent fluency, so more fluent than the agrammatic non-fluent subtype, but less fluent than the semantic subtype. Oftentimes that's because of some word finding hesitations or what we call phonemic paraphasia. So a certain sound of the word is substituted for the accurate or target sound they're looking for. So something like plate for plate. They also have some impaired naming and impaired sentence repetition. So difficulty keeping especially long phrases or sentences in their head long enough to be able to repeat it back to us. That's why we make people go through the hardship of actually saying these sentences back to us, even though it's not very fun in testing. So this is a sample of a logopenic patient describing the picture. So as you can tell, some word finding difficulties, some phonemic paraphasia, some inconsistent fluency. And oftentimes, this subtype is associated with Alzheimer's pathology, but again, keep in mind that it's not a typical, the symptoms aren't the same as someone with a typical course of Alzheimer's disease. So some communication challenges that individuals with PPA may experience. So oftentimes, almost everyone I work with says they know what they want to say, but they can't get the words out. So it's important to know that even though they may know what the object is that they're trying to name, they just can't find the word for it. Adjusting to a new communication style, for instance, feeling rushed to get your thoughts out when you may need more time to get the words that you want to use. Loss of previously enjoyed activities. Unfortunately, a lot of activities involve communication. So adjusting to a lifestyle where communication is a little bit more difficult. So some loss in that area. Communicating the problem to others, that's really difficult, especially if you have difficulty communicating. And it's not a common diagnosis, so that's really hard to express to people. An increase in boredom because maybe some of the activities that you did in the past you don't do anymore because of the communication difficulties, and just feeling self-conscious and less useful because of these impairments. Some other challenges, a lot of times care partners come in to the clinic and ask, how much is my loved one understanding? And that's really difficult to assess. But we do our best to assess this, and some ways we do this is figuring out how well they can follow instructions, multi-step instructions, and then it's important to look at how much purposeful behavior your loved one is having, but we're more than happy to help you assess this in the clinic. I'm going to talk a little bit about the therapeutic approaches. I'll be going over this in a workshop in the afternoon, so I'll go in more detail then, but I'll summarize a little right now as well. So speech and language therapy is often very useful, especially in the mild stages. It's important to know that the speech and language therapy is a lot different than the speech and language therapy a clinician would use if you have an aphasia from a stroke. So instead of focusing on rehabilitation, you're focusing on compensatory strategies. So how to get around your language difficulties in the best way you can, using your strengths to communicate what you want to say, knowing that you have those difficulties, rather than, for instance, memorizing a word list. That's not going to be as useful with this diagnosis. And because of this, it's really important for a family member or a friend to come to the speech and language sessions with your loved one, because the therapy is actually just as much as important for the caregiver as much as the patient with the diagnosis, because you're both adjusting to a new way of communicating. Some assistive technology can be really helpful, especially for the non-fluent agrammatic subtype. You can use iPads or different types of communication books to express words if you have difficulty pronouncing them. I often think that a physical notebook with organized in a personalized way is the best way to go, because you can flip through the book and have categories that pertain to that certain individual. So maybe things like favorite restaurants, medication, doctors, family members, vacation spots, and that way they don't have to think of the word necessarily to come up with the idea and can just point to it. So the goal is functional communication, and what I mean by that is the goal isn't perfection. It's just a way to get the communication out in the best way the person can. So again, not focusing on perfection, so not testing your loved one, just using their strengths to really communicate the best way that they can. PPA support groups are really useful. It's not often that someone with this diagnosis can meet someone else with this diagnosis. So I found that the support groups are vital, really. And when talking about that, last year we did a pilot program. Some of you are in the room who were part of it. And we had 8 individuals with PPA as well as 8 family members who came in with them. We had an interdisciplinary team, many speech pathologists, and music therapists, Katie Brandt, Dr. Dickerson. We all came together to try to educate and provide support for everyone involved. And it was a lot of sessions and a lot of time, but we really found it extremely useful for people. We researched the group, so we gave pre and post surveys to all the members who did it, and we saw an increase in confidence of the individuals with PPA in communicating, as well as better health for the loved ones who are part of the group as well. So our goals of the group were to improve functional communication, learn about PPA, that's really important, as well as the research we're doing, use music and movement therapy to enhance communication and connection, and provide emotional support to caregivers as well as patients. And we're planning on having another PPA support group for people in the mild stage of the diagnosis in May. We're hoping to do that. So please come and talk to me if you're interested in doing it. I'll be available all day, so please come and talk to me about that. So I want to also touch on our research goals. Dr. Dickerson went over this a little bit, but currently our goals are to monitor and measure areas of impairment and severity, so that way when there is a possible treatment, we know how it's affecting people. So is it slowing down the progression of the disease? What is it doing? And the only way to really know that is to look at everyone and see how each person in the different subtypes, how they're progressing. And then it's also important just because a lot of people come into the clinic and ask, like, how long until my loved one will have difficulty understanding me? And by being part of the research, we can better answer those questions. So one way of helping our team to monitor the different areas of speech and language is using the progressive aphasia severity scale that Dr. Dickerson and Daisy Hochberg created in the lab. So it enables us to look at all the different areas of speech and language. So there are as you can see, many. There's articulation, grammar, fluency, word retrieval. There's a lot of different things to look at. Language is very complex. So this scale is between a 0 and a 3 rating scale. So 0 being normal, no issues, 3 being non-functional, 0.5, 1, and 2 being in between. And what we do is we use clinical judgment based on history, exam, and interviews with the patient and the caregiver to come up with these ratings, because as Dr. Wong and Dr. Dickerson mentioned, it's not just the testing that we look at. And we also interview the patient as well as the caregiver to understand what types of problems or difficulties a person is having in daily life, because that's just as important. So thank you, and if you have any questions, I'm here throughout the day. Feel free to come up and introduce yourself.